Welcome back to Sleep Medicine and Physical Therapy. Today, we're continuing with Part 3, Physiotherapeutic Management of Sleep Disturbances. Today's topic is Insomnia, Physiotherapeutic Approach. This is HKMU Physio Chris. Let's get started. The role of physical therapy in insomnia disorder. Physiotherapy can act on chronic insomnia as an adjuvant treatment, or in some cases, being the treatment, depending on the type of insomnia, duration, clinical condition of the patient, and various contextual issues. The physiotherapist should consider how insomnia negatively affects the physical condition and overall health of the patient, but certainly how the physical condition interferes with insomnia, which can help to direct physiotherapy intervention. Insomnia may result from an acute or chronic condition, and it will negatively impact the rehabilitation process. Insomnia may be a symptom of a disease, and depending on the diagnosis, the physiotherapeutic approach will be different. The treatment of insomnia disorder is mainly cognitive and should include sleep hygiene, physical exercise, light therapy, mindfulness, acupuncture, and soft tissue massage. Current guidelines have indicated cognitive behavioral therapy for insomnia, CBTI, as a first-line choice for the treatment of insomnia. CBTI is a structured program that aids patients to recognize and change thoughts and behaviors that cause or worsen sleep issues with habits that promote sleep, affecting the ability of sleep. CBTI works with the precipitating, predisposing, and perpetuating factors of insomnia, intending to break the cycle of negative emotions, thoughts, and behaviors related to sleep. Pharmacological intervention should be adopted by a physician in case of a failure of impossibility of CBTI. To be considered effective, non-pharmacological therapies should reduce sleep onset latency and fragmented sleep, and the daytime repercussions such as sleepiness, unrefreshing feeling, and a lack of concentration increase total sleep time. However, very often, therapies may not demonstrate altered objective outcomes. The therapies can have positive impacts on the patient's functional complaints, reducing symptoms of anxiety and depression, and improving quality of life. Sleep hygiene is the most widely used behavioral intervention in the treatment of insomnia. This method was developed to guide patients about healthy habits to promote sleep and treat insomnia and many other sleep disturbances. Nevertheless, it has become a behavioral treatment for chronic insomnia. This technique can be combined with other resources, and the patient must understand why changes in his or her habits are needed. In recent decades, the regular practice of physical exercises has been studied as a treatment for insomnia. Studies investigating the acute effect of physical exercise on insomnia disorder have identified that acute, moderate-intensity aerobic exercise is effective in improving sleep and reducing pre-sleep anxiety when performed in the late afternoon, and acute morning exercise can improve nocturnal sleep quality in individuals with difficulty initiating sleep, especially during the latter part of the night. For the chronic effect of exercise on insomnia, aerobic exercise performed at moderate intensity, resistance exercise performed at moderate intensity, and stretching have been considered effective. Some mechanisms that can explain the effects of exercise on sleep are as follows. Thermogenic effect. According to this theory, the increase in central temperature caused by exercise would facilitate the onset of sleep due to heat activation of hypothalamus-controlled dissipation mechanisms. Patients with insomnia present a reduction of nocturnal temperature. Anxiety reduction. Anxiety is one of the markers of insomnia. Reducing it via exercise could improve sleep quality, and this effect has been observed in patients with insomnia. Serotonin increase. Chronic insomnia may result of a serotonergic defect. Acute exercise, like running, increased the synthesis of 5-hydroxypyrimidine. Antidepressant effect. And there exists evidence on the chronic effects of physical exercise on depression in insomnia, which correlated with improvement in sleep quality. Immunological changes. Training with moderate exercise can improve immunity. Depressive symptoms, poor quality of sleep, and systematic inflammation markers, like interleukin-6, are frequently associated. The search for manual therapies has been growing considerably, including massage. From constant skin stimuli on the body surface, touch, pressure, heat, vibration, and pain receptors are activated and transported to the somatic, autonomic, and the central nervous system, triggering important neurochemical reactions. The effects of massage on the circulatory, lymphatic, and muscular systems are already well established. Massage improves visceral functioning and restores body homeostasis. Massage is pointed out as a pleasant intervention as it promotes relaxation and sleep, as well as patients in insomnia to treat sleep complaints. In a multi-center investigation, massage was applied for the treatment of insomnia, and after subjective evaluations of symptoms, 96% of the participants reported significantly improved of insomnia. Despite some findings, massage alone is not recommended for the treatment of chronic insomnia due to an exceptionally low level of evidence. However, due to few side effects and its high power of relaxation, massage can be used as an adjunct to the treatment of insomnia. Final considerations. The patient can seek a physiotherapist to treat insomnia, and the physiotherapists can observe the symptoms and refer to the specialist for diagnosis. Physiotherapists should be aware of red flags, indicators of possible serious pathology such as inflammatory or neurological conditions, structural musculoskeletal damage or disorders, circulatory problems, suspected infections, tumors, and systemic diseases, where serious medical disease may present as insomnia complaints, such as other sleep disorders, depression, anxiety, substance abuse, bipolar disorder, and menopausal symptoms. Contents covered. The role of physiotherapy in insomnia disorder, cognitive behavioral therapy for insomnia. We've also talked about sleep hygiene, physical exercise, massage, and final considerations. This is the topic of insomnia, physiotherapeutic approach. I'm Chris, physiotherapy student, signing out.